This presentation is about sentiment analysis, as well as the use of surveys and time to next complaint for health administration programs in universities across the United States. Next is a YouTube video providing an example of a student complaining about a teacher.
For me, last semester, fall, I had a professor who was, a bit, nobody liked her really. Like, her class was boring. She was very dull. She had a very droning voice. And, I could, look.
What is sentiment analysis? Sentiment analysis is a technique which attempts to organize and quantify open-ended textual comments. In other words, one can organize and quantify a cohort of individuals' opinions on a topic from their written comments. In order to achieve this, we looked for words that convey a certain opinion. Some examples include love and pleasing. We then examine the number of times the word is used in the text, how it is used, and the context in which it appears to which individuals approve or disapprove of the thing being measured. What is the minute survey and how is it analyzed? According to Rethinking Satisfaction Surveys by Dr. Alemi and colleagues, the minute survey is intended for the evaluation of satisfaction with care in a variety of settings. 4 pieces of information are recorded, 2 by the provider, visit and location code, and 2 by the patient, overall rating and open-ended question. A critical difference between a minute survey and other patient satisfaction surveys is that minute surveys look at the total experience and do not pinpoint any unique component of the experience. Alemi and colleagues further indicate that the central idea behind the minute survey is to ask the bare minimum questions necessary. Although we did not use minute surveys in this particular sentiment analysis, they are very useful for healthcare providers. In this analysis, we used comments from Rate My Professor to determine satisfaction with professors. What is time to next complaint? Time to dissatisfied patient is a method used in conjunction with the minute survey to reduce the number of patients surveyed. By focusing on the interval between dissatisfied patients, the power of the analysis is enhanced and the number of patients needed for the survey is reduced. In this analysis, we will be looking at time to next complaint by student for each professor. The slide displays a visual of the time to next complaint for all professors who teach in health administration programs across the United States. It also serves as a benchmark for comparison. We will be using Professor Lieberman from the University of Central Florida as an example for how this analysis can help you in your classes. As you can see, Professor Lieberman is not doing well compared to colleagues at other universities. Analysis of comments from Rate My Professors can help Professor Lieberman define student dissatisfaction and help improve course content and other factors for next semester. This is an example of a complaint for Professor Lieberman who teaches in the Health Administration program at University of Central Florida. We extracted and analyzed his comments provided by Rate My Professor. Comments were then grouped into praise or complaint categories based on the adjectives from the comments. The adjectives were later used in determining the frequency of negative or positive words. There were 38 comments made for Professor Lieberman at the University of Central Florida between December 7, 2003 to May 3, 2010. Of those comments, 26.32%, which were 10 comments out of 38, were praise, while 73.68%, 28 out of 38, were complaints. Let's take a closer look at the reasons for complaints or dissatisfaction. Each comment from Rate My Professor was analyzed. There are 5 different reasons for dissatisfaction. 1. Instruction, 2. Course content, 3. Resources, 4. Personal demeanor, 5. Academic rigor, and 6. Other. As previously mentioned, there are 28 complaints. Each of the complaints fell into 6 categories. Academic rigor and personal demeanor related complaints were the most frequent. This serves as an indicator of where professors have room to improve student satisfaction. As you can see, there are many advantages of using sentiment analysis for your health administration programs, which include comments on Rate My Professor take less time to do, which can improve collection rate. Comments focus on overall satisfaction or dissatisfaction rather than source. They cost nothing to print, distribute, and collect because it is web-based. Allows for more time spent on analysis and making changes in processes. And finally, Rate My Professor is geared to allow students to express feelings. We hope that you will decide to utilize sentiment analysis to improve your programs. Thank you.
Please refer to the following sources if you have any further questions.